The World Health Organization, WHO, has said it needs more information to assess the latest surge in COVID-19 infections in China, but called the global concern and uptick in travel restrictions understandable. In the absence of comprehensive information from China, it is understandable that countries around the world are acting in ways that they believe may protect their populations, WHO Chief Tedros Adhanom Ghebreyesus wrote on Twitter late on Thursday. He urged China to be more forthcoming with information about the state of the pandemic. On Friday, senior Chinese health officials held a video conference with WHO officials, China's National Health Commission said in a statement. They discussed the current situation, medical treatment, vaccination and other technical matters. The United States joined several other nations in demanding negative COVID-19 tests from travelers from China, after Beijing announced it was ending mandatory quarantine on arrival, prompting many Chinese to make plans to travel abroad. We remain concerned about the evolving situation and we continue encouraging China to track the COVID-19 virus and vaccinate the highest risk people, wrote Ghebreyesus. We continue to offer our support for clinical care in protecting China's health system. China believes all countries' responses to COVID-19 should be scientific and fair, Chinese Foreign Ministry spokesman Wang Wenbin said on Thursday. Beijing has insisted it has been sharing relevant information and data with the international community, and said the COVID-19 requirements being imposed by countries on travelers from China should be based on science. We shared the sequence of the new coronavirus at the first instance, and thus making important contributions to the development of relevant vaccines, drugs in other countries, Wenbin told a media briefing on Friday. The worldwide coronavirus death toll stands at nearly 6.7 million since the virus emerged in the city of Wuhan. Some countries including the United States have begun sampling wastewater from international aircraft arriving from China to track new variants. William Schaffner, an infectious diseases expert at Vanderbilt University Department of Medicine in Nashville, Tennessee, said testing wastewater has become increasingly common. William Schaffner, an infectious diseases expert at Vanderbilt University Department of Medicine in Nashville, Tennessee, said testing wastewater has become increasingly common. Testing wastewater from passengers incoming from China will give a sense of which strains of the virus are out there, that's very important, Schaffner told Al Jazeera. We may be able to get a better sense of whether new variants are cropping up in China, variants of possible concern, he said. According to him, a contributing factor to this surge of infections is the opening up of travel. People are permitted to go out and about, there is an opportunity for the virus to mutate and create new variants that might evade the protection of our current vaccines, he said. Beijing transparent. China maintains it has been transparent with its information, despite its health commission announcing it would no longer release an official daily COVID-19 death toll. China has always been publishing information on COVID-19 deaths and severe cases in the spirit of openness and transparency, said Commission official Zhao Yahui on Thursday. Restrictions unwarranted. The European Union's health agency said restrictions on travelers from China were not warranted as a unified bloc-wide policy across its 27 member nations, at least for the time being. The European Centre for Disease Prevention and Control, ECDC, said it regarded screenings and travel measures on travelers from China unjustified.